Wait, hold on. Do you know about like honeypotting? People that like get asked on dates and then they get asked questions about their work and then they're like recorded. This is I
What
feel
are you
like
talking
well,
about?
now you're like asking me my opinion about these conspiracies. I feel like I'm not supposed to answer it.
How's everybody doing? My name is Anthony Brian Logan, and today we got to talk about someone from the NIH, that's the National Institute of Health, spilling the beans about how the COVID-19 directives were completely BS, made up, and the vax was pushed through in a very unnatural time frame. Normally, when they push forward a vax, it takes a while. They got to go through clinical trials. They got to go through this and that. And this one, it went in the same. Now, this is the very same thing that I and many of you have been saying from the very beginning. Why would you get a vax that they developed, quote unquote, in 9 months? Okay, we're going to be the guinea pigs, the test subjects. Oh, it's going to be safe, ABL. It'll save lives, ABL. What about in 20 years? Am I going to be calling the hotline talking about 1-900, you lost your forearm and your kidneys because you got that vax in 2021 that was required by your job? Is that what we're going to do? And of course, we've seen some side effects, allegedly, myocarditis, pericarditis. That's what we're seeing right now. But again, what about in 20 years from now? What are we going to see? Who knows? They don't even know. I think they asked my man right here who's been set up kind of. They asked him, he's like, hey man, only time's going to tell. Now, before I go any further into it, let's go ahead and jump straight into the video. Shout out to James O'Keefe and the O'Keefe Media Group for this. I will link to the full thing. I won't play it here, but I'll link to the entire thing in the box. You guys, please support James O'Keefe. Support everybody doing this undercover investigative work. This is true journalism. We don't see it too much more from the mainstream media because they don't want to go after the people that butter the bread, if you understand what I'm saying. But without further ado, let's go ahead and roll it.
What do you think about the NIH now that you were working there?
Probably shouldn't be like saying this out loud. They might have funded Wuhan, a lab in Wuhan, China, to like make and Pfizer and Moderna are just getting a bunch of money from it, from all these vaccine mandates.
Roger Cholin is with the National Institute of Health.
For other vaccines, like measles or whatever, you had to go through several rounds of approval, but these were accelerated through the approvals.
Let's pause. So, as I was saying from the beginning, other vaccinations, you got to go through quite a bit to be able to get it approved. Several rounds of approval, but this one, they pushed it right on through, and there was a bunch of money made. They pushed it through. Pfizer, Moderna, all these companies made big money, tons of money. They pretty much cashed a blank check of American taxpayer revenue. Congratulations.
Do you think that those, like the mRNA is safe? It's like really affected people with the myocarditis stuff?
Well, I think we're all going to learn when it's too late.
I think that's important. The lack of effect.
This is Robert Malone here, a physician and biochemist. And you know what's crazy? One of the craziest things from C-19, the height of it, is that they were discrediting doctors, actual doctors who treat patients and have been treating patients for 20 years. No malpractice allegations, no nothing. These are really good and smart people that were thrown completely under the bus and away by the federales, by the mainstream media, because they did not toe the line of what was the big thing back then, which was, hey, support the vax at all costs. It doesn't matter if you're going to die of a heart attack after you take it and you're 18 years old and healthy and you about to go to the Navy. It don't matter. Anyone who speaks against it, cast them away. It was really crazy. But I digress.
Effectiveness of the vaccine product.
Like the 6-foot rule. Remember that? Like that wasn't like based on any real evidence that did anything. It was completely made up.
Well, what do you think? Like, happy to be real with it.
Roger then brings up politics, talks about which political party he prefers and what would happen to him and NIH under an incoming Trump administration.
So who do you think is better for a guy like him? The guy that's talking in the date, the Trump administration or Biden, Harris, regular old, who's better for him? Take a wild guess.
I think it would be worse for the NIH. I think it would be better for a Democrat to be in office. We sometimes fly under the radar of like the really street guys. I don't think it would impact you. I don't think I have too much to worry about. That's not recording, right?
Yeah, yes, it is recording. And so you want the Democrats to come back so you can fly up under the radar and just kind of do things that you normally shouldn't be doing if you had proper oversight. Okie dokie, got it. All right.
Roger Cholin is with the National Institute of Health, or NIH, and has only been on the job for 2 months.
All the other branch chiefs are like 55.
Wow.
And I don't know shit. I know about the like subject matter, but I don't know about any of the government, like how budgets work or how like the hierarchy works.
In his role, Cholin oversees 40 people and heads up the Health Data Standards Branch for a division of NIH called the National Library of Medicine.
Now, someone may try to say, hey, ABL, this guy's a nobody, just a random person, random worker. Nah, he appears to be somebody, the chief, in charge of 40 people. I think you're somebody and you know a little bit. So when you're talking out on the date like that, I think you are telling the truth for the most part. And why would you lie about such serious things? Especially when you know, as I showed from the beginning, that this could be a honeypot, you could be recorded. He's actually actively talking about that. Hey, hopefully I'm not being recorded. Hopefully not a honeypot. So he's aware of those things. If you're aware of those things and you wouldn't make up stories that could look bad upon you or the organization.
So the U.S. National Library of Medicine, you can think of it as the nation's health library. All the major peer-reviewed journals are there, and they have electronic databases, electronic cataloging. They manage the PubMed application that makes all this information available to the general public. They manage clinicaltrials.gov, which is the application that summarizes clinical trial results. And it appears that what Mr. Cholin's division, this health data standards, is responsible for is analysis of visual data. This is X-ray and MRI data, analyze and develop new capabilities that will make these kinds of information and data more generally available for searching.
While he admits he may know nothing about the bureaucracy, he says he knows a lot about public health.
What do you think about the NIH now that you were working there? Obviously, lots of conspiracies about that. My cousin is like,
About
a
Fauci?
conspiracy. Yeah.
Well, I don't. So I'm not. Probably shouldn't be like saying this out loud. I haven't gotten the latest COVID shots, and I'm not going to.
Oh, look at that. The chief of health data standards at the NIH says, I ain't getting that, and I'm not getting no more. So if he's not getting it, then why would I get it? This guy's on the inside. This guy has intimate knowledge of what's going on behind the scenes of the vaccine, the standards, and everything else. If he's not getting it, why would I get it? And for the record, if you guys are new here, I have never gotten the C-19 vaccination. I don't ever plan on getting that unless somebody just bamboozled me. Okay, somebody just knocked me upside the head. I'm unconscious. And then while I'm unconscious, just hit me with the vax right quick just to do it. Aside from that, I'm not going to get it. And by the way, I've also never in my life had a flu shot, and I don't plan on getting it. And to be totally honest, I think they're going to just combine it. They probably already done it. COVID shot, flu shot is all one thing, all the same thing.
There's mixed evidence about if it really does anything.
Cholin then goes on to tell our undercover journalist that people under 30 are more at risk for heart conditions from the COVID vaccine.
For people that are like 30 or under, it really increases your risk for like heart conditions. The data does show that. I don't even know if these vaccines stop you from getting COVID.
They don't. They already said that. They said Rochelle Walensky, I think the former director of the CDC, she came on TV and said that the virus does not prevent transmission. She said that on television.
Our vaccines are working exceptionally well. They continue to work well for Delta with regard to severe illness and death. They prevent it. But what they can't do anymore is prevent transmission.
This was back in, I think, 2021. So we've known that for a while. If the CDC director gets on television, CNN, and says that, she's probably not lying. Their claim is that it prevents you from going to the hospital. But if you get pericarditis at 22 years old and die, then it didn't do that now, did it? I'm getting triggered, so I digress.
They don't.
Really?
I don't think so. Like, it's supposed to make you less sick if you get it. I don't know if it really prevents the transmission of it.
He is speaking casually, candidly about the risks of the virus, the risks of the vaccine product, particularly as it relates to myocarditis, the lack of effectiveness of the vaccine product. He's saying that it doesn't prevent infection.
It doesn't work. Basically, it doesn't work because when you're talking about vaccination, it's supposed to prevent you from getting the thing. That's what it's supposed to be there for. Now, if it's a therapeutic and it lowers your symptoms, you're talking about cough syrup, basically cough medicine. Okay, it's not going to stop you from getting the cold, but if you have it, it can just ease your symptoms. That's what this is. But obviously, cough syrup is a lot less dangerous than the C-19 vaccination, quote unquote vaccination.
It doesn't prevent disease. These are statements that I had made back a few years ago that I was called a liar for saying by the Washington Post.
But now there is some evidence out that NIAID, National Institute for Allergy and Infectious Disease, that's where Fauci was the director.
Okay.
They might have funded some labs to do vaccine studies and disease, to prepare for an outbreak. They might have funded a lab in Wuhan, China, to make COVID.
They did that. Everybody knows it. That's not even a thing anymore. Remember? And look, I'm gonna pause it there. I'll leave the rest of this in the box so you can check it out for yourself. But as I close, I want to say this. Remember when C-19 first broke out and they tried to say it came from somebody eating a bat at a wet market in China? I was like, for real? So that's the story you want to go with? The Wuhan coronavirus lab that's right there is not the source. Maybe there was a lab leak and it got out to the surrounding area and then it spread to the whole world. Maybe that's what happened. I bet the dumbest people on planet Earth. And I think I'll leave that right there for now. And what say you? What's your thoughts about my man spilling the guts, spilling his beans about what's happening with the NIH and C-19 and all this stuff, talking about, well, I'm not getting that shot. It doesn't even work. Whatever your thoughts are, let me know in the comments below. You guys know where I'm at. The more we see these undercover tapes, the more we get to the truth. That's all I'm concerned about. Left, right, whatever, that's one thing. But the most important thing when talking about journalism is getting down to the truth. So shout out James O'Keefe. Shout out to his former people, Project Veritas. Shout out to Stephen Carter with his undercover tapes. You guys are doing the Lord's work. This is what Elon is talking about. We are the media. I include James O'Keefe and Stephen Crowder. I include those guys as being the new media because the mainstream media, old school media, legacy media are failing at their job. They're not getting to the truth. They're just pushing advertising messages. They're just trying to generate revenue, trying to generate clicks and ratings. And it's all about money, not about getting down to the core of the reality of things happening in this country and in the world. But whatever your thoughts are, please let me know in the comments below. And that's all I got to say for this video. If you like what you heard, please comment, rate, share, and subscribe. Peace.